Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I am currently completing my placement with the Organization for a Safer Space. Today, I will be talking about autophobia. In this video, we'll first look at what autophobia is. We'll then look at some risk factors and causes, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Autophobia, also referred to as monophobia, eremophobia, or isolophobia, is a severe fear of being alone. A person can have this fear when they are alone or when they are with other people. They may find it difficult to function normally until they are around others to feel safe. They may also experience anxiety when there is no threat of being alone. People with autophobia may know they are physically safe, but they still fear burglars, strangers, being unwanted or ignored, being unloved, being away from a certain person, being home alone, and solitude. Risk factors. The risk factors of autophobia can include a family history of phobias or anxiety disorder, a personal history of other phobias such as agoraphobia, panic disorder, borderline personality disorder, which involves an extreme fear of being rejected, abandoned, or alone, leading to difficulties managing emotions, and dependent personality disorder, which leads to difficulties taking care of oneself, and a fear of being alone due to feelings of helplessness. The fear of being alone can be caused by negative or traumatic experiences, often during childhood. Causes of autophobia can include being ignored or feeling abandoned, parental separation, divorce, or death of a parent, separation from a loved one in public, being alone during a panic attack, injury, or dangerous situation, witnessing a traumatic event and not receiving support from others. Other traumatic experiences can include abuse, financial issues, neglect, parental substance abuse, and serious illness within the family. Symptoms. People experience autophobia differently. People with autophobia may have the following symptoms: anxiety, dread, intense sadness, intense worry about being alone, anxiety when anticipating loneliness, desire to flee when alone or avoid isolation in the first place, depersonalization or feeling detached from one's body, feeling secluded or ignored around other people. The physical symptoms can include sweating, chills, shakiness, dizziness, heart palpitations, hyperventilation, upset stomach, and nausea. Effects. Autophobia can affect one's social and occupational life. A person with autophobia may not want people to leave, although this can be impractical, lack independence in relationships, and remain in unhealthy relationships to avoid being alone. Autophobia can also increase the risk of medical conditions such as depression, substance use disorder, and post-traumatic stress disorder. Treatment. The treatment for autophobia involves therapy and/or medication. Cognitive behavioral therapy, or CBT, is a common type of psychotherapy that teaches people new ways to think about their phobia of being alone. CBT can also help people gain the confidence to confront their fears and anxiety and cope using practical techniques. Another type of therapy that can treat autophobia is exposure therapy. For autophobia, exposure therapy involves gradual exposure of being alone for increasing time periods in a safe and controlled environment to reduce anxiety. Medication may also be prescribed by a healthcare professional. The medication can include beta blockers, which decrease adrenaline effects on the body during anxiety experienced when a person is alone. Coping strategies. To alleviate anxiety of being alone, a person can include the following coping methods: deep breathing, progressive muscle relaxation, visualization, self-assuring statements, developing a support system, such as having someone to talk to when alone, exercising regularly to reduce stress and enhance mood, eating healthy, and reducing or avoiding caffeine, alcohol, and drugs. If you have any of the symptoms described in this video and they impact your daily life, it is important to seek help. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.